Hi, Mike Gibson, Dr. Adhir Shroff, coming to you live from San Diego at SCAI 2018. We're talking about SCAI's program on transition for value. Tell us a little bit about that program.
Yeah, so thanks for asking. I really appreciate the opportunity to kind of share this program with you. And so what we did was we wanted to help physicians and hospitals try to increase their use of transradial access as a vehicle or as a means to improve value, primarily to patients, to the clinicians, and to the medical centers by decreasing complications, potentially decreasing length of stay. And we think radial access is one way to help do that. And so we find that when you look at sort of the data across the country, a lot of centers are sort of dabbling with radial access and only using it in 5–10% of cases.
Really? That's hard to believe. I mean, what's the national rate of transradial PCI at this point?
Well, now the data it's around in the almost 40%.
I see.
But there's a lot of variation. There's some places that are 80–90%,
right,
and there's some that are 0.
So it's a bimodal distribution, essentially. Yeah. Interesting.
Yeah, if you look at the most recent paper that looked at this from 2016, I think Dimitri Feldman, you can see there's like a pretty sharp up curve, and then it really kind of trails off in terms of radial penetration. And so we think that there's a lot of opportunity to teach people at different stages along the way. And I think that some people, what we wanted to avoid was having like a cookie cutter approach that everyone had to do it the same way. And so what this approach is, it's on the internet, and it's a web-based portal where people can go, and then they can, wherever they are stuck or wherever they need help, they can download a module. And all the authors were all members of the Vascular Access Working Group from SCAI. And so we all put these modules together. And the goal is to help people navigate those sticking points that they have in their practice, whether it's them, it's the nursing staff, administration, their partners, whatever the issue is. We're hoping to kind of help them, give them tips and tricks on how to overcome those barriers. Mm-hmm. And ultimately the goal is to being able to apply this to a more complex patient population. I think we all agree that a healthy 45-year-old doing a diagnostic cath, I think the access site's really not that important. It's like the 80-year-old lady with a non-STEMI who's got a creatinine of 2. Those are the patients we're really worried about, and how do we treat those patients. Mm-hmm. And so we see a lot of avoidance of using radial access in those sicker patients, and I think it's partly a lack of education, and we're hoping to get people to that point.
So you focus a lot on access here in phase 1, radial access. How about complex PCI? Where are you at developing toolkits for that?
Great question. And so I think that's certainly in our next phase of this. We hope that with this initial phase, it'll be the foundation to get people to understand how just something simple as access can lay the foundation for value. And then really with the next iteration of this program is really focusing on complex PCI and looking at bifurcations, left main, CTO, atherectomy, even STEMI. And talking about what are the opportunities there. What we wanted to avoid is we didn't want people to run before they could walk and start doing STEMIs in shock when they don't even feel comfortable doing simple intervention. So that's kind of where it's going to go. But I think it's only going to magnify the positive impact of this access approach on a more sicker population.
God, it just feels like yesterday you were a fellow with me, and now you're all grown up.
Thank you. I appreciate all the education.
Yes,
and
thanks.
This is a great service.
Thanks, Adhir. And thanks to all of you for joining us here live from SCAI 2018.